So lower leg special tests, fracture tests. I'm going to show you 3 fracture tests. First one is for a fracture to possibly tibia or fibula. So lateral malleolus is the typical fracture that we're looking for with this test. So it's called a compression or squeeze test. You're not going to squeeze at the area. You're going to go away from the area. Focus on trying to squeeze the tibia, find where the fibula is, and tibia and fibula together. And what you're looking for when you squeeze together like that is not pain or discomfort where you squeeze, but pain distal to where you squeeze at the specific area of fracture site. So you're looking for pain on the bone. You can also do a long bone compression test, same kind of concept, but you're going to compress through longitudinally through the bone. So if we have like a concern of a metatarsal fracture, we would grab the the distal phalange and try to compress through. So I'm actually loading through this area and trying to compress through it, but this would be if I'm concerned about a fracture in this zone. Same with the other toes, I can compress through it, and we're looking for pain away from the site of compression. The other test we do, which is typically for a bump test, is for a fracture to the talus, or maybe even to the tibia or fibula. We're going to use the calcaneus and use the heel of our hand. So we're going to bump heel of the hand to heel of the foot, and we're going to bump pretty firmly, and we're looking for that radiating pain going upwards. Like if we're concerned about the talus fracture or tibia or fibula fracture, that's a possible check for it. So those are 3 main fracture tests that I want you to know. So ligament test. So anterior draw test is our lateral ankle sprain test, looking for a sprain to the ATFL, the anterior talofibular ligament. So the goal with this test is you can do it hanging off the edge, but I'm going to do it in this position. Relax your foot for me. So go super loose. I'm going to stabilize the tibia and fibula with one hand. Whatever foot I'm testing on, I'm going to use the other hand to do the test. So left foot, right hand. I'm going to look at the sinus tarsi, so I stand medially to the foot. I'm going to grab the calcaneus with my 4 fingers. I'm going to take the foot into about 10 degrees of dorsiflexion. So if we assume that is about neutral, we're going to drop down just slightly to 10 degrees. Have them make sure they're relaxed, and we're going to try to draw the talus forward on the tibia and fibula from pulling the calcaneus. And we're looking for laxity or increased translation in comparison to the other side to test it, or pain at the ATFL, but really it's increased translation, spongy end feel, and laxity where there's a bigger stretch. So that would be our anterior talofibular ligament test. Our next test is going to be talar tilts. So I'll do one test from this side, and then I'll have you switch to this side. So if we're checking for the CF ligament, because an inversion talar tilt would be a CF ligament, check. I'm going to use my opposite hand again because it's the left foot for this test specifically. Though for the eversion test, I would actually use the same hand. But so I'm going to use my thenar eminence, this part of my hand, stabilize the ankle just like before. I'm going to grab here at the ankle, and I'm going to push from the calcaneus, forcing them into inversion. And what I'm looking for is that translation, or that extra kind of stretch or empty feel at the CF ligament where it feels loose, right? A little loose actually. Eversion talar tilt. Actually, bring this foot up for me. I'm going to use your right foot. So eversion talar tilt. This is the one where you would actually use the same hand as the foot. I'm stressing the deltoid ligament. Now, eversion, we don't have as much eversion, but same concept, but obviously I'm on the medial side. So for the left foot, I would be on this side, but I'm using the right foot. Same concept, but now I'm trying to stretch at that deltoid ligament. And I'm looking for pain at the deltoid ligament, but mainly translation, and then increased stretch there. And that is checking for the deltoid ligament. Homensign test. Oh no, Geiger's test. High ankle sprain test. So bring your left foot down again. So a high ankle sprain test is testing for anterior inferior tibiofibular ligament. And what we're going to do is stabilize the ankle, and we're going to force the foot into dorsiflexion and eversion, or external rotation. I like to use my leg for overpressure. And what we're trying to do is force separate the tibia and fibula to see if they have pain here. So this, although it's a ligament test, it's not a laxity test. It's a pain test, pain provocation test between the tibia and fibula, forcing the foot into dorsiflexion and external rotation. And I'm going to use my leg for overpressure. Okay. Okay, 2 more tests. Homenside test is testing for deep vein thrombosis. It's not a great test, I don't believe. It's basically what you're going to do is you're going to bring the foot up. Usually you have the foot in mid-air actually, or sometimes hanging off the edge. You're going to force the foot into dorsiflexion at the same time, kind of squeezing the calf. And you're basically just looking for pain. Do they have this like dull, aching, throbbing pain going through their calf? And it's looking for deep vein thrombosis, like clotting in the lower leg. The problem with that is if they have like a calf strain or something like that, they're also going to get pain on that. So that's why not necessarily a great test. So it's pain into the gastrocnemius. Flip on to stop. Last test is for your Achilles tendon rupture. Scoot back this way for me. So if I squeeze the calf and the Achilles is attached, the foot should slightly plant flex. Ready? See that slight plant flexion in the foot? So, but if it's detached and we're looking for Achilles tendon rupture, which is what this test is for, so a Thompson test is a squeeze of the gastrocnemius muscle, and a positive sign would be if the foot did not point down. So if I saw no movement in the foot when I do that, then we would say that would be an absence of plant flexion, which would be a sign of an Achilles tendon rupture. Done.